Welcome to Biohacking with Brittany. Thank you for tuning into today's episode. I'm your host, Brittany Ford, a holistic nutritionist, content creator, podcaster, and all things biohacking and functional optimal health. So thank you for tuning in. I'm really excited to talk about this topic today. I wanted to do a solo episode on the science-backed benefits of breastfeeding for moms, what every mother needs to know. The reason that I wanted to do this is I feel like as a breastfeeding mother right now, I was never really educated on the health benefits for mothers. There is a lot of talk about the health benefits for babies and kids, and rightfully so. They are the people, or they are the kids who are, drinking the milk and getting the benefits from it. But I never really see content that talks about how it can benefit mom and mom's health and mental, emotional, and physical well-being. So I started doing some research into it and found that there actually is a lot of research on it. And there actually is a lot of benefits for mothers. And so I wanted to kind of put this into one episode so women can find it easily and really understand what's going on in their bodies when they are breastfeeding. I'm going to dive into the incredible health benefits of breastfeeding beyond just the nourishing your baby. I'm going to explore the research and science behind breastfeeding and how it can accelerate postpartum recovery, promote weight loss, reduce the risk of certain cancers, and improve long-term health, including cardiovascular health. Whether you're a new mom or you're planning to become one, or you're just kind of curious about the science, this episode is packed with data and expert insights to kind of help you understand why breastfeeding is such a game changer for maternal health. A note that I do want to say before I dive in is that any breastfeeding is phenomenal. Whether you can do 1 month, 2 months, 1 year, 2 years, anything is fantastic. I understand how hard it is to breastfeed for so many women out there, how difficult it can be, how strenuous it can be, and not just physically, but also emotionally for a lot of women. And so a lot of women end up stopping. I understand that. And I think while breast is best, I also think fed is best as well. So anything that you can do to feed your baby is phenomenal. And I want this episode to be, educational and inspiring, and in no way critical or anything like that if you're struggling to breastfeed or you can't. So anything you can do is great. And I encourage you to just keep doing your best as you can as a mom, as a parent to be, whatever you might be. I think you are doing phenomenal. And I just want to throw that side note in there so that you know that this is a place where everybody is welcome, regardless of your situation. Before we dive in, a shout out to Bioptimizers. If you are a mom or you're a mom to be, holy smokes, I seriously suggest getting their mushroom breakthrough powder. It is great. It is my afternoon pick-me-up. It's filled with mushrooms that help your brain function better without any stimulants. So yes, I take this while breastfeeding. I'm not concerned about, it going through my breast milk. And I really rely on this in order to help me have better memory recall, energy, because I definitely can feel that afternoon slump. So if you're kind of feeling like that, you're tired, you're in between naps and running around kids, and you need something that's healthy and holistic and not filled with sugar and stimulants, their mushroom breakthrough powder by Bioptimizers is fantastic. And they have 3 flavors too. So they do chai, salted caramel, and chocolate. Now, chai is my favorite right now. I feel like it's very fall. So that's kind of why I'm drinking it. And I add it to nut milk and I drink it around 2:00 every day. And I feel great. So it's got like chaga in it, cordyceps, everything you need to basically help your brain function better. Mushrooms are so, trendy right now. So it makes sense that this is one of my go-tos. So I really suggest you grab a tub, enjoy it. And the tubs are actually really large. So it lasts a really long time. So you can use my discount code BiohackingBrittany to get the most off. And yeah, let me know what you think. I've been suggesting this to all of my new mom friends as well. So maybe I'll give it away as well. Maybe we'll do a giveaway. That might be nice. Anyway, check it out. Bioptimizers, discount code biohacking Brittany. All right. So let's dive in. I really want to talk about how this is such a powerful, biohack, I guess, or just option for women, for mothers out there. The first topic I definitely want to talk about is recovery. Now, breastfeeding can really speed up recovery for new moms. Breastfeeding stimulates the release of oxytocin, which helps the uterus contract and shrink back to its pre-pregnancy size. The American Academy of Pediatrics reports that this process can significantly reduce postpartum bleeding and help prevent complications like hemorrhage. Women who breastfeed typically experience quicker uterine recovery and shorter postpartum bleeding periods compared to those who do not breastfeed. So there's actually research that backs that up, which is wild. So I think this is really cool to think about, like that release of oxytocin helps the uterus to contract and shrink. And, for all the pregnant mamas out there who, or soon to be, or haven't had a baby yet, it's really interesting after you have your baby because your uterus is still actually large and it takes a while to shrink back. So, after I had my baby, you don't go back to like a flat stomach or whatever size you were right away. Like you actually still look 4 or 5 months pregnant for, however long, maybe a few weeks or 10 days, whatever it might be. And then your uterus slowly starts to shrink back and it kind of all slowly kind of goes back into place. So it makes sense that something like the release of oxytocin, which is like this feel good, calming love hormone, can kind of help that shrink back and help with any stress as well. And it helps reduce the postpartum bleeding because it helps it shrink back in a faster manner and just helps with recovery in general. And also, we definitely want to prevent complications like hemorrhage. I've only have one baby and then we're breastfeeding so far. We're 3 months in. And so that has kind of been my experience. I haven't experienced it otherwise, but it makes sense that there is also research that backs up this faster postpartum recovery of the uterus and physically. A big benefit of breastfeeding that a lot of people talk about, it's probably the number one thing that people talk about, is weight loss. Or weight management. So the reason that this is talked about so much is because breastfeeding can burn an additional 300 to 500 calories per day. According to the Journal of Women's Health, women who breastfeed tend to lose their pregnancy weight faster than those who do not. A study found that breastfeeding mothers were able to return to their pre-pregnancy weight quicker while preserving lean muscle mass. This happens because breastfeeding uses up fat stores built during pregnancy to make breast milk. So, I've spoken to many moms about this and kind of heard both things. Some say like, yes, it's an amazing aid for weight loss. Some say, it didn't really make a difference. But, my overall arching thought behind this is like, this is not a diet strategy necessarily. Like you shouldn't really be thinking about breastfeeding in that way. It's just a natural process that kind of happens designed to support mom and baby. So for me personally, I'm 3 months postpartum and I lost about half of my baby weight within, I don't even know, the first 2 weeks. It was really rapid, but right now I still have half to go. And so even though I am breastfeeding, my, weight loss has significantly slowed down since those first few weeks. So I think this breastfeeding is definitely helping. I definitely have not put on weight, but I still have quite a bit to go in terms of where I would like to be size-wise. Now, I think there's something important to note about this is that there's also the caveat that your body will hold on to fat in order to make enough breast milk to feed your baby. So while you can burn it and use it to feed your baby, there will also be the instinct and the hormonal play there where your body will say, no, we're holding on to this belly fat because if there's famine, if there's not enough calories coming in, if I'm not eating enough, we have enough to support the child. So what I've also seen a lot of women talk about is that, yes, the breastfeeding can help, get you back to that size. But once you actually stop breastfeeding, after a year or wherever you are in where you think you should stop, the rest of it kind of falls off, quote unquote, because you no longer need to hold on to this in case there's an emergency and you have to feed your baby. So I think, I wouldn't say there's a hard or fast rule with this. I think you can fall into either category. I personally think I'm in the latter. Like, I think that as we start to introduce solids in a few months, I think the rest of it will kind of fall off in the next, 6 months or so, which would be great. And that's kind of what my perspective is and what I've seen with my body. But then there's also some women who just kind of lose all of it, right? And maybe they're not eating enough calories to support this additional 300 to 500 calories per day that they are burning through creating breast milk. My suggestion is to definitely make sure you are drinking enough fluid. You need so much water, so much hydration to make enough breast milk. You need enough calories. So make sure you're getting enough food and make sure you're getting enough fat. Something that I found very helpful was increasing my fat intake in order to make fattier milk. And if you create fattier milk, then your baby is satiated for longer, right? So breast milk tends to be about 10% fat. And so you can kind of see that if you pump any and you put it into a bottle, you can see how it separates and the fat goes on the top. You really want as much fat as you can get. I've noticed a difference when I eat more fat, my milk is fattier and my son is filled longer. So that's kind of what I do now. And the way that I do that is I do bulletproof coffee now, again, in the mornings. I'm eating way more eggs and 4 eggs a day type of vibe. And I started taking cod liver oil mixed with butter oil that's fermented, which is a very Western A price thing to do. So that's a brand new supplement. I haven't really talked about it yet. If you want my link for it or the brand that I'm taking, let me know because it was really hard to find. But I'm really increasing my fat intake to make fattier milk for my baby. So yes, I think breastfeeding can help with weight loss. I would just, if you're new to being a mom or you're pregnant, you're going to be pregnant, I would just kind of lower your expectations a little bit. A lot of women, it's not like it all just falls off right away within the first few weeks. A lot of women kind of go through losing half and then losing the second half within 6 months. Because I actually researched it. I looked it up. I was like, what's normal? And that's exactly what normal is. You lose half within the first, half within the first 6 weeks. And then the other half within the first 6 months is what I read online, what most women go through. So I am very much fitting into that. And I think that is a very reasonable way of looking at it. Next, I want to talk about how breastfeeding reduces cancer risk. This is the type of thing that I'm actually super interested in. Weight loss is cool. Recovery is interesting. Great. But I want to talk about long-term health diseases, what is actually happening when we're breastfeeding that's supporting, how is it anti-cancerous? How does that work? So lowering the risk of breast and ovarian cancers through breastfeeding is what is happening. Studies published in the Lancet and Cancer Causes and Control show that the risk of breast cancer decreases by about 4.3% for every 12 months of breastfeeding. Additionally, breastfeeding has been linked to a lower risk of ovarian cancer due to hormonal changes that delay ovulation. That's interesting. So let's back up here and talk about breast cancer for a second. It is decreased by 4.3% for every 12 months of breastfeeding. That means that every 12 months you breastfeed for every kid. So if you have 3 kids, you breastfeed each for 2 years. Think about how much of a percentage that is dropping for you for your risk of breast cancer, which is incredible. Absolutely incredible. So, you move it by 4.3% for kid number 1 if you feed for 12 months. You have kid number 2, you feed for 12 months again. That's another 4.3% that you've dropped it, which is just incredible. Women who breastfeed for more than a year reduce their breast cancer risk by up to 30%. and their ovarian cancer risk by as much as 15%. Do you have trouble recalling names, dates, or where you left things? I definitely do as a new mom. I kid you not, I am forgetting things all of the time. I feel like I'm juggling so much in my brain, and it's really hard to keep clear-minded when you are taking care of a newborn. If you're struggling and you're finding it difficult to focus during the day, or you notice yourself zoning out when people are talking to you, your cognitive health and your brain could really use some love. Bioptimizers has created a one-of-a-kind product called Mushroom Breakthrough that can supercharge your brain power. It's packed with highly concentrated mushroom extracts that science shows enhance memory, focus, processing speed, and more. Just one serving contains 5 potent superfoods, collagen, and 1.2 pounds of 4 concentrated mushrooms: lion's mane, reishi, cordyceps, and chaga. This cutting-edge blend is a powerful way to rebuild your brain and rewire it for maximum energy, focus, and performance in less than 30 days. After each serving of Mushroom Breakthrough, your ability to memorize and recall information will improve. This is actually I notice such a difference with this. I'm serious. Every time I take this, I notice a difference. And you'll get a heavy dose of antioxidants for immune support. The way that I do this is I drink it daily. I add 2 scoops to a large glass of nut milk, and I drink this in the afternoon. It's my afternoon pick-me-up that is not a stimulant. And as a new mom, as a parent, I literally rely on this. This is like my mommy's milk, mommy's mushroom milk that I rely on to get through my day and really help my brain perform much better, kind of like how it used to before having a baby. So don't miss out on the brain boosting power of this amazing product. For an exclusive offer, you can go to bioptimizers.com/biohackingbrittany and use code biohackingbrittany at checkout. This will get you the most amount off. So if you even compared to like Amazon or anywhere else that you see these products, my discount code will get you the most off. So make sure you use it. Again, that's biohackingbrittany and use the code at checkout. And the great thing about Bioptimizers is that you can try it risk-free with their 365-day money-back guarantee. Try it now to sharpen your edge and reach your full potential. Now, I will say that the WHO, the World Health Organization, now recommends that breastfeeding is done for the first 2 years of a child's life. It used to be 1 year, but now it's increased to 2 years. And that makes sense when we kind of look at this data of it reduces your breast cancer risk by 30%. That's incredible. But I also think that that is coming from a place of understanding that breast milk is complex and it changes, and it is easily the healthiest food that you can feed your baby. It changes in order to give your baby exactly what it needs nutritionally throughout those first 2 years of life. I have friends who are still breastfeeding at 2.5 years. I have friends who stopped at 3 months. People are kind of all over the place with it. But I think it's incredible if you just look at the cancer risk and the fact that it can reduce ovarian cancer risk by 15%. I think what I just read recently, cancer is sadly something that is so prevalent in society. And I think it's now 1 in every 2 women will get cancer. And I think it's 1 in every 3 men will get cancer. So if we can do something like, breastfeed and something natural, and obviously it's hard and it has its challenges, but if we're able to overcome that, we can really reap these long-term health benefits for significant diseases like cancer. Breastfeeding's impact on hormonal regulation is also fascinating. Delaying ovulation can provide protective effects, which is why extended breastfeeding is associated with significant cancer risk reduction. So because it can delay that ovulation and delay your menstrual cycle coming back, I guess that is really what helps lower the risk of ovarian cancer, which is really interesting that that's kind of how that's correlated. But regardless, I currently don't have my menstrual cycle back. I don't have my period. I don't know when it's going to come. And I'm going to talk about that briefly. shortly here, but it does make sense that it's a protective mechanism through delaying that ovulation for, in the ovaries like that. The next health benefit is heart health and bone density. Massive, massive concerns for everybody, but for women for sure. So there are long-term cardiovascular and bone health benefits of breastfeeding. A Journal of the American Heart Association study shows that women who breastfeed have lower risks of high blood pressure, heart disease, and stroke. Additionally, breastfeeding improves bone density, which can lower the risk of osteoporosis and fractures later in life. Women who breastfeed for 6 months or more show significantly lower rates of heart disease and are 30% less likely to develop hypertension later in life. It's actually just incredible how breastfeeding supports not just immediate postpartum health, but also long-term well-being like this as well. Heart health is something that is so important, and bone density as well. Osteoporosis and things that really impact the bone like that are so significant for women. Bone loss in general is a big concern for women as you get older. And there are things that you can do to help with that. There's supplements you can take. There's food you can eat. There's, weightlifting is really great for strengthening your bones and keeping that bone density really strong. But if we can do something earlier on in life, 30 years maybe before you're kind of feeling those effects, then, kind of why wouldn't you? So I also just think it's incredible that, this journal study shows that women who breastfeed have lower risks of high blood pressure, heart disease, and stroke. If that's something that runs in your family, this is a great way to kind of support your health and make you less susceptible to those types of things. A big health benefit that I do want to talk about that I have definitely experienced myself is the mental health aspect of it and the power of oxytocin. So I briefly talked about oxytocin, but I do want to get into it a little bit more from this angle. So breastfeeding promotes the release of oxytocin, which is the hormone that enhances bonding and lowers stress. It's known as the love hormone. According to Maternal and Child Health Journal, mothers who breastfeed are less likely to develop postpartum depression. Women who breastfeed have been found to have up to a 50% reduced risk of postpartum depression compared to those who don't, due to oxytocin's calming effects and the physical closeness of breastfeeding. It isn't just about bonding with your baby. It's how this oxytocin really plays a crucial role in regulating stress and emotional well-being. So I definitely feel this 100%. When you're breastfeeding, you can feel this release of oxytocin go through your body. It is definitely calming. It definitely helps with stress. It definitely makes you feel more lovey. And I think that is so, so important. There's a couple things I do want to say about this. There are more people and new research coming out about breastfeeding while you're distracted and if you still get that same release of oxytocin. So I was listening to a podcast and they were talking about this, and they were saying that if you are on your phone while you're breastfeeding, if you're scrolling social media, watching TV, whatever you're doing, you actually are not getting the same amount of oxytocin release as you would if you weren't doing that. The highest amount of oxytocin that you can get released is when you're down, looking at your baby while you're breastfeeding, especially if you're making eye contact. So for me personally, I don't go on my phone when I breastfeed. I don't watch TV. I don't do anything, to be honest. I just sit there. It's 5 to 10 minutes, right? So I just sit there and I just look at my baby. I look around. That's kind of all that I do. I let my brain wander. And I definitely do feel this sense of oxytocin. And the times that I have gone on my phone, answered a text message, whatever I might have done, I've definitely been pulled out of that calming, meditative state that you get in while you breastfeed. And I don't like it. So I it's a hard rule for me, like no phones at all while breastfeeding. I also don't want the phone by my baby's face, head, body at all during that time, because I don't want him exposed to all of the EMF that kind of comes off of a phone or looking at a screen. Not that he would be looking, but still. So if you are breastfeeding, I really encourage you to take the time to just be present and enjoy that release of oxytocin for your mental health. It also helps the baby as well, right? Like it's very like bonding between the two of you. And if you're breastfeeding and you're looking at your phone and your baby's looking at you, look at your phone, that's not bonding. That's not creating that feedback loop between the two of you. So of course there's a time and place, but I really encourage you to try and just be present and enjoy that, oxytocin love hormone that is flowing through your body while you're breastfeeding. And the fact that it has been shown to be a 50% reduced risk of postpartum depression is really, really significant. As someone who's 3 months in, I can see how a woman would get postpartum depression. Now, this is not something I have experienced. I also had my genetics done, and I don't have any gene variations for depression, thankfully. Doesn't mean you can't get it, obviously. But I can see how women experience postpartum depression because the workload of having a baby is so significant. You are healing from pregnancy and birth. Who knows what your support system looks like around you? And it is a lot. It is a lot. And it's day in and day out, and there's kind of no break. And then you kind of get to this point where you're like, you start saying these things to yourself like, oh, this is my life now. That kind of saying, like 3 weeks from now, I'm going to be doing the same thing as I'm doing today. Nap, feed, diaper, nap, feed, diaper. And I can see how women slip into this depressive state and, feel sad or angry or bored or shameful or anything like that. And so it's really cool that the human body tries to support mama's mental health through releasing these really important love hormones while breastfeeding. So I encourage, you to breastfeed as much as you can. And I think as well, like I pump. So I pump once a day, sometimes twice a day, but I pump once a day, typically in the morning. And you don't get that oxytocin when you pump, right? Like you don't get that love, feel good hormone at all. It's not the same as when your baby is breastfeeding like directly on you. So I do a bit of mix of both, and I look forward to it, right? And if I miss it and we have to give him a bottle instead, there's a part of me that's like sad that I don't get to breastfeed because it's so bonding and so calming for the both of us. The next thing I want to talk about is breastfeeding as natural birth control. So this, little controversial, but let's kind of get into it. So people talk about this because breastfeeding delays ovulation and acts as a natural contraceptive. So this is known as lactational amenorrhea. So amenorrhea is the absence of your period. Exclusive breastfeeding can delay the return of menstruation and ovulation for up to 6 months, offering natural birth control with about 98% effectiveness as per the World Health Organization. In breastfeeding women, the median time to the return of fertility is significantly delayed, offering natural family planning benefits during this period. So, like I said, for me, we're breastfeeding all the time. I do not have my period, so I am definitely going through this lactational amenorrhea right now. I have a friend whose baby eats a lot less. She is smaller. She sleeps right through the night. She doesn't eat through the night. And she got her period back within like 8 weeks. That's not happening in this house right now, but I don't know when it will come back. That will be very interesting. And it does make sense that this happens, right? Like you do need ovulation, obviously, to get pregnant. And, you need that release of the egg and then the egg to be fertilized for pregnancy to happen. So if the egg is not being released, it does act as natural contraceptive. However, this is the caveat. The way that your menstrual cycle works is, I think most women listening to this know this, but is that you release an egg and typically around 2 weeks later, your period comes. If you're not tracking your cycle, you can release your egg and get pregnant if you are having unprotected sex, and then get pregnant that first cycle right away because you don't know that you're ovulating, right? So say right now I'm ovulating and I'm not tracking my cycle and I don't know my symptoms, maybe things are different because my body's different right now during postpartum. And then 2 weeks from now, I'm supposed to get my period, but I don't get it. And then I'm pregnant because we had unprotected sex. That is what happens to a lot of women is they get pregnant right away because they think their period hasn't come back yet because they haven't had a cycle, but they're not tracking their cycle. So they don't know they've ovulated before that first period. So my suggestion is to start tracking your cycle, start tracking your temperature. I use natural cycles to track my cycle. I actually haven't started again. Might be something that I look into probably next month. If you are having a lot of unprotected sex, definitely something to be thinking about because getting pregnant right away within the first 6 months would be very hard on the body. And that is not something I want at all. Personally, I would not manage that well at all. Physically, mentally, emotionally, my business, everything, that would be a disaster. So I probably will start tracking my temperature again through the Natural Cycles app just to kind of make sure that that doesn't happen with us. And I suggest you do that as well. So you could do the temperature method. You could track your cervical mucus. You could check your cervical position if you really know what you're doing, which I don't. I don't do that one. For me, the morning temperature is the easiest because I've done it for so long. And so just be cautious with this. It is effective, but there is that it's effective until that first cycle starts. And if you don't know your first cycle starts, it's no longer effective. So that is the caveat to breastfeeding as natural birth control. There are some other long-term mental and physical benefits from breastfeeding for mothers that I just want to briefly do a shout out for. Breastfeeding's benefits extend well beyond the postpartum period. In addition to reducing cancer and heart disease risks, it contributes to lower rates of type 2 diabetes and rheumatoid arthritis. A diabetes journal study shows that women who breastfeed for a cumulative total of 12 months or more have a 47% reduced risk of developing type 2 diabetes. That's wild. 47% reduced risk. It's just amazing how breastfeeding can support long-term health like that. And it's not just about, the baby, but it's also about you. It's interesting though, like with the type 2 diabetes, I wonder if that is because of the hormones released or the caloric burn that happens. So it's kind of like helping the whole insulin hormonal cascade. I'm curious why that is. And it's something that I should look further into. And, arthritis as well. Like, it's just really cool to see that breastfeeding has so much long-term health benefits for mom. And it's not just like this short-term oxytocin release, which we love, but it's also got these like long-term preventative measures as well. From faster recovery to weight loss, cancer, heart disease risk reduction, mental health support, natural birth control, long-term health protection. There's so much here and there's so much benefit of breastfeeding for mamas. And I really, like I said earlier, encourage you to do it for as long as you can. My goal is to get to at least a year, and then I will assess what I want to do from that point. Do I want to continue? It is a full-time job. I did a whole other episode on breastfeeding, my thoughts and everything about it. You can go and listen to it, but it is a full-time job. Someone actually calculated it. I heard this as well, is that in a year, if you breastfeed for a whole year, it's 1,600 hours, which equates to 40 hours a week, which equates to a full-time job. So it is not to be mistaken of how important it really is for your health. So go check out my other breastfeeding episode. there's lots of other goodies in there. If you want to talk about, increasing your breast milk supply, go listen to that episode. If you want any of the links or anything that I mentioned in this episode to the research or any of the products, send me a message or check out the show notes. It'll be in there. I think I'm going to probably do a episode on the Western A. Price diet and way of raising babies, because I'm reading the book and I find it fascinating. And it's very much aligned with like optimal functional health, functional medicine, optimal health, biohacking. And so I am probably going to talk about Western A. Price because I want more and more people to understand it and talk about it. And a shout out to the last episode. Was that the last one that talked about DNA test? So I think I did in the last, few episodes that came out, I did an episode on genetics and childhood, and we are getting Callahan's DNA tested. I think the test arrives today, and I'm going to do a full episode on his DNA. If you want to get your baby's DNA tested, let me know. I'll send you the link to the test that we got. It's saliva based. So it's really easy to collect the saliva from the baby. There's no blood. You don't have to do a prick or anything like that. And I'm going to talk about like the implications of understanding your baby's genetics, right? From everything from like how they are learning mentally to physically. Maybe they're more prone to be good at this sport versus that sport, but maybe they learn better visually, or maybe they're prone to this type of disease. We're also going to talk about autism, learning development, all of that type of stuff, and the genetics that are associated with that. So you can go back to my most recent genetics episode, and then I'll do a follow-up one with Callahan's results and kind of give you my 2 cents on them as well. Thank you for listening. I put out episodes every Tuesday and Friday. And this podcast has been my baby before my real baby for a long time. So please subscribe, leave a review. Anything you do is really helpful for the show. And I will catch you soon for another one. Thanks for listening to another episode of Biohacking with Brittany. If you're interested in finding the show notes or the sponsors for this episode, you can do so on my website, which is biohackingbrittany.com. Remember to follow me on Instagram, where I'm most active. My handle is @biohackingbrittany. And if you're interested in working together and you want to email me directly, you can do that. My email is info@biohackingbrittany.com. And I look forward to hearing from you and having you tune in next week.